The number of teenage mothers has for the last 3 years been on the rise, ranging between 24% and 25% in the age between 15 and 19. These cases have left the Ministry of Health officials scratching their heads, and the State Minister for Primary Health Care, Margaret Muhanga, says this is a reality that can no longer be ignored.
It's a very conflicting position. Nobody wants to talk about it, but let's share. Our children get pregnant at 13. Because these children are in our hospitals. These children are in our villages. These children are everywhere we go. And we feel pain as parents that what can be done. Where is the solution if children between 13 and 18 are sexually active?
Some of these cases have arisen as a result of child marriages, sometimes initiated by parents because of the need to get something small like cows or money in exchange for their daughters. The minister now proposes arrest and detention of parents over the same.
Even parents should also we should amend the law and hold parents who take bride wealth for a 13-year-old to be culpable. Maybe they will learn that it's not very simple. Even if it's my child, I am the one handing her over to the other man. So both of you are taken in, and then people can learn.
Muhanga was speaking to the media ahead of the Pre-Mother Care Day scheduled for next week. In this media engagement, the minister spoke against use of traditional birth attendants, whom she says have no technical knowledge and experience to help deliver children from their mothers safely. This, according to the ministry, can only be trusted with advising pregnant mothers to visit health centers where there are professionals to attend to them and give them proper and essential medical care.
They cannot be trained on any modern methods, they cannot be trained on risk assessment, they cannot be trained on management of complications. What is killing every one mother whom you see dying, it's a complication issue. And these complications are not within their means to comprehend and manage. Besides that, we cannot give them our medical supplies they are not trained to use. Most of these supplies have clear and limits in which you need to administer. If you give them medicine to administer 10 meals and they administer 20, the mother is gone.
9% of pregnant mothers across the country continue to give birth outside health facilities. This puts these mothers at the risk of dying while giving birth, but also losing their newborn children. These have been urged to seek medical attention as soon as possible to avoid any complications that might arise, leading to unwanted death.
A mother has a complication, is not well, but is not able to leave home because his fearing doesn't have transport, doesn't have resources, doesn't have any social support to move to seek care. The first delay encompasses numerous barriers that can affect a woman and her family awareness of a serious complication. Some women begin bleeding and they don't consider this as a serious complication.
Over the last 3 years, the ministry has upgraded over 300 facilities across the country to ease access to health services. The target is to see that all mothers give birth in health facilities where they can be attended to professionally so that the risk of loss of lives due to pregnancy can be eliminated. RAMSON, Church of Uganda Family TV, News at 8.